I'm Marcia Newell, and I'm Executive Director of the Clay County Hospital Foundation. I began here about 8 years ago and have just found Clay Center and this hospital to be a delightful place to be. One of my jobs is also working in the hospital for marketing and PR, but I probably enjoy the part of being the director of the foundation the most. The foundation began in 1987, and the first project that they did was to build the physician's clinic, and that is attached directly to our hospital, and it makes a wonderful situation for the doctors to be close when they need to come over and check on the ER. They need to come into the hospital to check on a patient. They are just steps away from their office. The foundation has made several projects in the hospital possible. Early on, they raised all the funds to do the first outpatient clinic. They contributed to the first wellness center that we had and to the birthing center. And then in 2007, after I got here, I got to be part of this group contributing $1.2 million to a $5.2 million project. And in that, we were able to have private patient rooms. We added on to the outpatient clinic. We created an entirely new wellness center. We created a therapy center to have occupational therapy, speech therapy, physical therapy, all of those things as support services for our doctors, so they have people to refer to for our patients to have treatment. We have a cardiac rehab department. I think that that was able to go into the old wellness center, and we were able to use machines there. Those things are just wonderful for our patients and keeping them here, keeping them loyal to our doctors, because statistics show people won't travel out of town to get cardiac rehab, and that keeps them at home. My husband and I spent 25 years in a rural Kansas county, and that county has a critical access hospital, and one of the things I want people to know is a critical access hospital is not a cookie cutter shape. What's out there for my in-laws who still are there is not at all what we have here. There is no pharmacy in the county where they live. There is no occupational therapy, no physical therapy, no speech therapy. There's no outpatient clinic. There's no in-house MRI. There's no CT scan. There's no nuke bed. There's no cardiac rehab. And yet that's a critical access hospital, the same as our title. But there's a world of difference in between the communities and the hospitals. One of the things I think a doctor coming to our area could count on is that this community supports the medical community. They support the doctors, and they put their dollars behind what they believe. They're grateful for the medical care they get here. People don't just come here and get dropped off. They're absorbed into the community. You can be a member of any civic club, any church. My husband and I have just been welcomed so warmly into this community, and I think a new physician would find that welcome equally as warm.